BBC Radio Norfolk.
And I'm pleased to say on the line we've got Dr. Zack Ally. Zack Ally, first of all, tell us about this research then. What do you think it tells us?
So the research, part of the UK media launch by Intraline, showed that nearly 1/3 of UK adults had aesthetic treatment for a change in job or career, which really underlines the fact that youthfulness still equates to success in the industry for many people. 1 in 5 women wanting UK fillers was actually something that appeared in our research as well. And a significant uptake in men requesting dermal fillers is also something that's been quite popular.
What are dermal fillers?
Dermal fillers are a cosmetic injectable treatment, which essentially is made up of a hyaluronic acid. Hyaluronic acid is something that is naturally produced by the skin in the body. And as we age, we lose hyaluronic acid, and therefore we lose volume and shape to our appearance.
And this is for cosmetic reasons, anti-aging?
Anti-aging, yes. Cosmetic reasons, yes, right.
1/3 of adults in this country. That's astonishing, isn't it? Were you surprised at that?
To be honest, I'm not surprised by that. I think the nature of the industry, the nature of what's available and how it works makes it more popular for many people. I think it's something we've been seeing for many years now, but it's starting to become a lot more popular as the awareness is growing. The reason for that statistic, in fact, is that with all these Botox and derma filler cosmetic injectable treatments, they're low invasive. They don't require an operation. You don't need to be in a hospital theatre or stay in a hospital overnight. They're reversible. They're not permanent. These are things that actually will wear off with time, and people having that awareness and knowledge are partaking in these treatments.
And the research that you've done shows that people are doing this very often when they have a new job to go to, or sometimes when it's wedding day and the bride wants to look a little bit more blooming than maybe she would have done otherwise. Are those the two main reasons?
They are indeed. And I mean, people, these type of, it's like getting your hair done or putting a suit on, really. People want to look more confident, and people want to be more confident, and looking good equates to better confidence, which therefore reflects in all these factors, the work, weddings, events, birthdays. That's not to be taken lightly, however. I mean, we do push for making sure things are done safe and effectively. It's not that anybody can actually have these treatments. People that do have these treatments actually undergo a consultation to make sure they're fully aware of what's available and who's a candidate for it.
Isn't it rather a shame that people worry about the way they look like this?
I don't think it's a shame. I think it's something that people pay more attention to. It's unfortunate that it does matter for many people in their line of work. I mean, there's the common saying, you wouldn't go to a dentist with bad teeth. But generally speaking, it's something that people care about these days, and it's something that is safer to do when it's done properly.
Can you see this growing in the future then? More people going in for these sort of procedures? Some of them quite minor, but some people, of course, go for the whole thing, don't they?
You're right, absolutely. I think the industry is growing. Currently, the industry is worth $4.6 billion, and it is growing because there's newer found procedures on the market. There is a limit to who can and can't have them, and as practitioners, as doctors, as people who actually perform the treatments, we make sure that people have a sort of cooling off period before they undergo a treatment. Which means in the consultation we don't hard sell there and then. We tell them about the procedure, make sure they're a candidate, and give them some time to think about it before they go ahead. I do see an increase, a significant increase, in fact, in non-surgical treatments as opposed to surgical treatments, for the fact that you can achieve the same thing with a lot less complications.
Is it expensive?
The procedures they're not cheap. They are expensive, depending on the type of procedure you have. I think with what you're seeing, really, they're fairly priced for what's available. Some people tend to overdo the treatments, particularly in the States, not in the UK. And for that reason, obviously, you're seeing major costs and therefore unhappy customers. So I think there's a big responsibility on the side of the practitioner to be going through all of this with the patient, making sure they're using the resources effectively and choosing the right treatment and saying no when it's not needed.
You talk about overdoing it, and really bad plastic surgery or bad cosmetic surgery is almost worse than none at all, isn't it?
Absolutely, and especially, as you say, with cosmetic surgery, because cosmetic surgery is permanent. It's something that if you don't like and it's gone bad, you're stuck with it for a long period of time. And what I always say to my patients when I treat them is, whenever you consider a treatment, think of anything is better than what I have now, to be sure before you go ahead with something. With cosmetic surgery, unfortunately, the complications are higher and it's more of a high-risk procedure in the sense that it is permanent. With non-surgical cosmetics, you can reverse a lot of the treatments, and they are not permanent. They are minimally invasive and can be done safely if you stick to landmarks.
Would I be right in saying, though, in conclusion, that the big change over the recent times has been men coming forward and wanting this done, whereas before maybe it was a preserve mainly of women?
Absolutely. I mean, until now, 90% of all aesthetic procedures have been carried out by women. But the research led by Intraline have shown that there's been a significant increase in men's demand for this kind of work. And I think, again, it comes down to awareness. Not all procedures are cosmetic. Some of them are therapeutic. People that have excessive sweating, people that have pain in the jaw, all of that can be treated with the same type of treatments. But with increasing demand and awareness, you're seeing more men undergo these treatments. That's right.
Is there a website people can go to get more information?
Absolutely. So intraline.com, people can learn about the products, they can learn about how it works and what you can achieve with it, as well as the training company, Derma Medical.co.uk, where they can learn about actually how to undergo the procedure and what goes wrong and how to manage that.
Well, Dr. Zack Ally, it's a fascinating insight into something which a lot of people, it appears from your figures, do experience and do know about and are willing to take a chance on. Thank you very much for coming on today.
My